Hey everyone, welcome back to AlphaNutrition. In this video, we're going to talk about HIV tests and whether they're always conclusive. First off, let's define what we mean by conclusive. A conclusive HIV test is one that accurately detects whether or not a person has HIV with a high degree of certainty. If someone tests positive on a conclusive test, they are considered to be HIV positive. If they test negative on a conclusive test, it's very unlikely that they have HIV. There are several different types of HIV tests available, and the accuracy of each type can vary. In general, HIV tests fall into two categories: antibody tests and antigen/antibody tests. Antibody tests look for the presence of antibodies to HIV in a person's blood or saliva. These antibodies are produced by the body in response to an HIV infection. It can take some time for these antibodies to develop, so antibody tests may not be accurate during the window period between when a person is first infected with HIV and when their body has produced enough antibodies to be detectable by the test. The window period can vary depending on the individual and the test being used, but most people will develop detectable antibodies within 2 to 8 weeks of being infected. In some rare cases, it can take up to 3 months for antibodies to be detectable. Antigen/antibody tests, also known as fourth-generation tests, look for both HIV antibodies and the P24 antigen, a protein that's part of the HIV virus. These tests can detect HIV infection earlier than antibody tests alone, usually within 2 to 4 weeks of infection. While fourth-generation tests are generally more accurate than antibody tests alone, they can still produce false negatives during the window period. Another type of HIV test is the nucleic acid test, NAT, which looks for HIV genetic material in your blood. This test is not commonly used for routine HIV screening because it's more expensive and takes longer to get results. However, it's the most accurate test and can detect HIV as early as 7 to 10 days after exposure. The next type of test is the nucleic acid test, NAT, which looks for HIV genetic material in your blood. This test is not commonly used for routine HIV screening because it's more expensive and takes longer to get results. However, it's the most accurate test and can detect HIV as early as 7 to 10 days after exposure. Additionally, do you want to know for certain whether the results are conclusive? The anxiety and worry can be overwhelming. The good news is that most modern HIV tests are highly accurate and reliable. But it's important to understand the different types of tests and when it's appropriate to get tested. First, let's start by understanding what we mean by conclusive. In the case of an HIV test, a conclusive result means that the test is accurate and reliable enough to detect the presence or absence of HIV antibodies or HIV genetic material in your blood or oral fluid. If the result is negative, it means that no HIV antibodies or genetic material were detected, and if the result is positive, it means that HIV antibodies or genetic material were detected. There are some other factors that can impact the accuracy of an HIV test. For example, if you have recently had a flu shot, this can cause a false positive on the HIV antibody test. Additionally, if you have recently had a blood transfusion or organ transplant, this can also impact the accuracy of the test. It's important to note that a negative test result doesn't necessarily mean that you don't have HIV. The time it takes for HIV antibodies to show up in your bloodstream can vary depending on a number of factors, including the specific type of test being used. In general, most people will develop detectable antibodies within a few weeks to a few months after infection, but it can take longer for some people. The timing of when you take an HIV test can affect the accuracy of the results. Different HIV tests have different window periods, which is the time between when you were potentially exposed to HIV and when the test can accurately detect the virus. During this window period, HIV may not be detectable even if you are infected. There are also several medications available that can help prevent HIV transmission. Using condoms during sex, avoiding sharing needles or other drug injection equipment, and taking pre-exposure prophylaxis (PrEP) if you're at high risk for HIV are all important steps in reducing your risk of HIV infection. If you are living with HIV, there are also many treatment options available that can help you stay healthy and manage the virus. Antiretroviral therapy, or ART, is a type of treatment that involves taking a combination of medications to help keep the virus under control. In conclusion, it's important to understand the different types of HIV tests and when it's appropriate to get tested. If you're unsure about your risk for HIV, talk to your healthcare provider about your options for HIV testing. Remember, early detection and treatment of HIV can lead to better health outcomes and prevent the spread of the virus. If you have concerns about your HIV status or you have engaged in behaviors that may put you at risk for HIV, it's important to speak with your healthcare provider about getting tested. They can help you understand your options and choose the testing method that is most appropriate for you. If you have any questions or comments, please leave them below. And as always, don't forget to like and subscribe for more videos from AlphaNutrition.